with children, how soon can you detect myopia?
At any age.
Really?
Oh, wow. Even like a baby?
Yes.
Wow.
So we recommend definitely before school age, bring your kiddos in, even if they don't know their ABCs, 1, 2, 3s. We have instruments and technology to actually see if they have a prescription, whether they need glasses or even contact lenses, because you want to give your kids the best head start.
Of course, of course.
Welcome to Care Experts, a podcast dedicated to providing the inside scoop on health and self-care.
Make sure you join us each week for candid conversations with wellness and medical specialists.
Yes, real experts here to help you make the best choices for you and your loved ones.
I'm Melissa, a native Texan living in Atlanta.
And I'm Selah, a Californian through and through, and we're your co-hosts.
That's right, we're both proud moms here to have meaningful conversations with experts from all over the country who empower, inform, and inspire.
From cosmetic to dental and vet to vision, this is Care Experts.
Hey, Selah, how are you?
Hey, Melissa. I'm good. How are you?
I'm really good. I'm so glad that we're back here and getting to talk about something that is so important.
Seeing each other.
Yeah,
you know
because it's
what
good
I
to
mean?
see you too.
I
We're
can't
so
help it.
cheesy.
Every
We're
time.
so cheesy.
Every time I have to do it. Well, you know what? It is good to talk about the eyes because the eyes are the window to the soul.
There you go.
I
mean,
can't help it.
You're such a visionary. Is that good?
Yeah,
Thank
that was
you. Thank
actually
you.
very good.
I appreciate it.
Very original. But we're talking about eyes today. If you haven't picked that up by now.
I mean, yeah.
Come on.
We're talking about myopia,
Uh-huh.
which is just a very fancy medical term for
Nearsightedness.
There you go.
Which we both have.
yes, I'm nearsighted and I
Yes.
have astigmatism. We could talk about that all day long.
Yes, but I fixed my nearsightedness with LASIK.
Oh, and I've yet
Yes.
to do that. I'm still
know.
in my daily disposable contact lenses. But what I've noticed as I'm getting older is that every year it's deteriorating. By it, I mean my
Right.
vision just a little bit.
Right.
But where it's like, it's like barely noticeable. But then if I think back to 10 years ago, I'm like, wait a
Uh-huh.
minute.
Well, don't they say it's like 100% of the population is going to need
I've heard.
bifocals? Yeah.
That's what I've
I
heard. That's why
know.
every drugstore you go to has those cheerleaders on the
yes.
corner. Yeah,
Yeah.
right by the pharmacy.
Well,
so.
and it's going to be great to talk to our guest today, Dr.
Ooh,
Precious
yeah.
Hwang, all
Dr.
about
Precious
the eyes.
Hwang, that's right. She is a glaucoma-certified optometrist at Rancho Santa Margarita Optometry in Southern California.
Yes, she graduated the Southern California College of Optometry cum laude.
Ooh, cum laude. She's really smart. I love
She's
that.
very smart.
And Dr. Hwang specializes in treating and managing ocular diseases, fitting hard and soft contact lenses. I'm a soft contact lens wearer as we know. And co-managing cataract and LASIK patients.
Yes.
So she'd see both of us. Oh, wait.
Yes.
She would see both of us.
I like what you did
like
there.
that?
Yes, I did.
I can't wait to talk to Dr. Hwang.
It's going to be great. Let's bring her in.
Come on in here, Dr. Hwang. Let's chat. We are joined today by Dr. Precious Hwang. This is so exciting. Welcome to the studio. Welcome to the pod.
You are a very well-known optometrist at Rancho Santa Margarita Optometry, which is operated by Total Vision.
Yes.
Okay.
And you completed your clinical training at Las Vegas Veterans Hospital, the University Eye Center, Los Angeles, and Ketchum Health and San Diego Naval Station.
Wow.
It sounds like you've been doing a lot of work.
Yeah.
To get to this
Very,
point. Yeah.
very difficult.
Yeah. Dr. Hwang, what made you want to study the eyes?
You know, a lot of it was just patient care. So as optometrists, we get to spend a lot of time with our patients, listening to what their needs are, questions. It's a lot of fun because originally I wanted to become a dentist.
Oh.
But I quickly changed my mind in my last year of school.
Oh, why?
Really?
Why'd you change your mind?
Made a shift.
I just realized dentistry is great. They
Sure.
do awesome work. You know, I see my dentist every 6 months.
Okay,
Yeah.
good.
But it's just not what I wanted to do, just staring down, doing procedures. I
Yeah.
wanted something that I really enjoyed. And I could actually, you can build a relationship with anyone, but I just really felt like it was my niche, like working in optometry.
You were helping people to see, opening up their eyes.
Yeah.
Yeah, literally.
Okay, so our topic of discussion today is myopia.
Yes.
What is myopia?
Myopia, which sometimes is called nearsightedness, is a condition where you have blurred vision in the distance.
Oh, I have myopia.
Yes, you do.
Oh.
I know.
Okay.
Well, and can people, this is actually, I have no idea. Can people have both myopia and what's the other one called?
Oh,
You
sure.
can see only near.
Right. So,
I mean, only far.
right,
Farsighted.
right. So I like to say a magical time for all of us after our 40s. At my office, we call it birthday candle syndrome, is a lot of folks who are nearsighted, wear glasses, contacts to see far away, will start to notice when you have your correction on, it's harder to see up close, whether it's your computer or reading when you have your glasses or contacts on. That's called presbyopia.
Oh,
Yeah. But
Okay.
I'm just starting to get that, Selah.
no.
It's not fun. So, Dr. Hwang, I wear soft contact lenses daily, right? Hopefully not for much longer. But I wear soft contact lenses daily, and it's because I have astigmatism and I can't see far away without correction, right? But I have noticed, like when I'm reading my Bible or any book or anything kind of up close or looking at a screen, I'm now doing this. I'm like, when did that happen? I'm in my early 40s, and you said it's the birthday candle.
We call it birthday candle syndrome.
So is that an official term, Dr. Hwang? Okay, birthday. Doctor, I have birthday candle syndrome.
I think God, I had LASIK.
Yes.
So yes, I love it. It was life changing, and we're trying to get Melissa on this train of LASIK.
Yeah, because I was told, I mean, and again, I know technology changes, but I guess I accepted as fact that when one optometrist told me at least 10, 15 years ago that I wasn't a good candidate for LASIK, that meant not just then, but forever I wouldn't be. So who is a good candidate for LASIK?
So in general, it's very case by case.
Okay.
We look at your age, your occupation, your prescription, of course. Technology has definitely changed since 10, 15 years ago. Just like our iPhones, our phones are different.
For sure.
Think how much newer technology there is available. Great question to ask your eye doctor. Because we look at also like your lifestyle, your hobbies, your avocations. What do you do? I always say like it's not always concrete. Let's take a look. And there's a lot of other factors that we'll start to look at, like for example, dry eye plays a big role. But almost any prescription these days, you can be a
LASIK.
candidate. Yes.
Did you get LASIK?
I actually still wear contact lenses.
Okay.
Yes.
Wow. What is your choice to do that versus, or as far as being a
Right.
It's a
candidate?
case by case basis.
Yeah, I know. I want to know what her.
Yeah. Okay. Go ahead.
Yes. So for myself personally, I actually have a really low prescription.
Oh.
Right. I'm only slightly nearsighted with astigmatism, glasses and contacts when I'm out and about. For me, it's still on the back burner for me. I just haven't pulled the trigger yet.
Okay.
But I see it's a great option. Yeah.
That's a great option. That's now with children. How soon can you detect myopia?
At any age.
Really?
Oh wow!
age.
Even like a baby?
Yes.
Wow.
So we recommend definitely before school age, bring your kiddos in, even if they don't know their ABCs, 1, 2, 3s. We have instruments and technology to actually see if they have a prescription, whether they need glasses or even contact lenses, because you want to give your kids the best head start.
Of course. Of course.
I haven't even taken them into the eye doctor. I, mean,
I
just the
haven't either. I
pediatrician,
mean, the
but-
pediatrician,
Yeah.
well child
The well
check.
checks,
Like,
right.
yeah, the
Exactly.
dentists have done that before, but I didn't realize it was time to do that already.
I didn't either.
Dr. Hwang, what is the difference between myopia and other refractive errors like hyperopia? Am I saying that correctly? And
Yes.
astigmatism.
Yes. It all comes down to blurred vision and also shape of the eyes. Individuals who are nearsighted or have myopia have a long, elongated eye, which usually translates to blurred distance vision. Individuals who are farsighted, or it's called hyperopia, have small, little eyes. Depending on the prescription, they can have trouble seeing far away or up close. That one's a little bit tricky to describe. Astigmatism has to do with the shape of your eye. Your eye is not perfectly round like a ball. It's a little bit oblong like a football or melon. Usually blurred distance visions, or patients will kind of notice like, hey, when I drive at nighttime, I have these stars or halos around lights, or
yeah.
details are hard to see. And you can have a combination of everything.
Oh gosh,
Right.
that's amazing. And are there genetic or environmental factors?
Yes.
Okay.
So let's say a child with both parents who have myopia compared to a child with one parent with myopia or no parents with any glasses or contact lenses in general have a higher chance of needing glasses or having vision problems as they age. It's all in the genes.
Oh, my
All the
kids are
genes.
doomed. Both of us.
So myopia is caused by genetics?
It's yes.
Partially,
Genetics
mostly?
is one role.
One
It's
role.
also the environment. So
Okay.
when we were growing up, we didn't have screens.
Right.
I
We
knew
didn't spend-
screens are going to
Yes.
factor in. Go ahead, Dr.
We
Hwang.
played outside, children these days, even outside of school, and even as adults, we look at our little screens, iPads, computers, phones. Studies have shown it's the near focus, which can trigger myopia. So that's why I say it's a combination of both your genetics and the environment and our lifestyle, what we're doing these days.
For sure.
And that's one of the reasons why we always recommend with kiddos, hey, limit screen time if
Yeah.
it's not related to school. Play outside. Outside is a great place to kind of relax our eyes and prevent that myopia or nearsightedness.
Yeah.
Yeah, we've heard about the 20-20-20 rule.
Yeah.
Yes.
Is that right?
Is that something that we should all be doing?
Yeah.
All of us at every age.
So remind me what 20-20-20 is for.
Right. So when you're working on a screen or, looking at your phone or Kindle or what have you, whenever you're focusing up close at near, every 20 minutes, look 20 feet away, blink or rest your eyes for 20 seconds before returning to your activity. It helps prevent eye strain and eye fatigue because all of us, regardless of your age, just staring at
Yep.
something really close for long periods of time, all of us will have tired eyes, dry eyes, and for little kiddos or young adults, it can lead to the progression of their myopia.
Oh gosh, I've got to definitely have my kids.
I know.
And my husband who works at a computer all day.
Same.
Right? And I've noticed that his eyes get very red. Is that also due to that eye strain?
It's, partially the eye strain. It's also partially dryness.
Oh.
So when we focus or when we're on the screen or reading, we don't blink very frequently. Blinking is important because every time you blink, you actually coat the front surface of your eyes with tears, which is lubrication.
Patient, yeah.
Yes.
And he uses Visine a lot,
no.
which is the
Oh no. She said, oh no.
So is that the worst? We heard it was the worst. Is that
Oh
true?
no.
So, in short answer, yes.
She's like, I don't want to bash Visine, but that's not the route to take. Why
No,
not?
it's been around for ages.
Yeah, it's a
well
household
marketed.
name.
It's on the cheaper end of eye drops, so patients just gravitate toward it.
Sure.
I always say no Visine, no clear eyes, and actually no generic eye drops.
So what
would you
should we be
use?
using? Yeah.
Right. Drops that we recommend, like top brands. I'm not endorser.
Right, right.
Of course
backed
not.
by any
Right,
companies. Sustain is a great brand. Refresh eye drops.
Okay.
TheraTears. There's so many good ones on the market. And part of that is it depends from person to person. Just like your LASIK question, we look at what is the cause of your dry eye, what are you doing during the day. And I always let patients know, just like your skin gets dry and you put lotion on your skin, same concept with our eyes. Our eyes get dry, put drops in the eyes to make them feel better, vision's better, everything's better.
Everything's better. Just not Visine drop.
Just not Visine. I know.
I'm going to go home and clear it all out. I'm not going to know what to hit him. Wow. So how do you determine the best treatment option
For myopia.
for myopia? Yeah.
So we look at a lot of things for treatment of myopia. For our kids and young adults, there's a lot of things we can do these days. So when we were growing up, every time you went to the eye doctor, your vision got worse, you need stronger glasses, we'll see you next year.
Exactly. Exactly. Mine finally tapered off.
Right,
Yeah.
right. So we know through studies, children and young adults up to early to mid 20s, likely your vision or prescription will get worse. So our treatment these days includes soft or specialty contact lenses or glasses to slow the progression. Atropine eye drops, which actually help slow the progression. There are also the hard lenses that we talked about, the rigid gas permeable lenses that children sleep in, which reshape the cornea, where they don't need glasses or contacts during the day, and which also slow down the progression or change in myopia.
Wow.
There's so many options, and we look at, how old your child is, what if they have fear of contacts, if they have fear of certain things. We really like to have a conversation with our patients and the parents, and we pick a modality that works best for everyone.
That makes sense. What are some of the signs that your child or someone you know and love might be nearsighted or have myopia?
Headaches, eye strain, not performing well in school, blinking frequently, squinting, and the worst complaint ever is actually no complaints. Some kids believe what they see is normal. I've had families come in, they come in for one sibling, they tag along the others.
Yeah.
And much to the parent's surprise and the child's surprise, we're like, oh, your little child here actually needs glasses for the classroom.
Wow.
And we see their response when we show them the prescription and just how much of the world has changed.
Yeah.
So like I said, it can be so many different symptoms or complaints or no complaints at all. They don't know.
Wow.
What they don't know.
Yeah.
Yeah. And I mean, if they haven't been diagnosed, what are the potential long-term effects of an untreated condition, untreated myopia?
Right. So, untreated myopia, again, can cause, performing poorly in school, low confidence. They're just not confident in what they're doing, what they're seeing. In general, they're struggling. It's the quality of life. If you think about it, do we use our eyes every single day?
I mean, every
Yeah.
day, all day,
Yes.
right? Constantly.
Right,
It's
right.
quality of life.
Yeah.
Yeah.
It's everything to us. So it's very important, even if you feel like your child does not have any vision problems, even if yourself or your spouse doesn't wear glasses or contact lenses, bring your kids in. I always let parents know vision screenings at the pediatrician's office and at the school. They're excellent. They do catch a lot of kids that need glasses or contact lenses. But at the same time, some kids kind of slip through the cracks there.
Yeah.
And so it's important to cover all of our bases.
Yeah, I'm going to make those appointments.
I was thinking the same thing. I'm like, okay, mental note, make that
Make those
appointment at the
appointments.
optometrist for your son to see, and just
Exactly.
because the better you know, earlier you know, the better,
I
right?
agree. Well, is that why probably I wasn't diagnosed with it until I was probably 10 years old?
Oh.
Is it because I was doing those well kid visits, but
Yeah.
maybe it wasn't caught? I don't know.
Hard to say.
Okay.
Hard to say. Because a lot of us will develop myopia at different stages in life.
Oh, okay.
Some at younger ages, like, oh, at first grade, I got my first pair of glasses. Other folks, hey, I was in high school or college. And
Maybe the
again,
prescription just
yeah,
got worse.
right,
I see.
right.
Okay.
A
that
lot of
makes sense.
factors,
There's a lot of
right.
things. Okay. So, what are the effectiveness of these treatments for children? I know you talked about like the contacts and the
Right.
how does it usually heal itself? Like when you were saying you wear them overnight, what's the effectiveness?
Right, right. So effectiveness overall usually translates to how is it slowing down the progression? Like technically there's no cure to
Oh,
completely
okay.
stop myopia because it's part of the developmental process. You can look at all the numbers. A lot of these treatments are FDA approved.
Oh, great.
So they're proven to effectively slow down the progression. So my example is always like, hey, as a parent who might be a -8 prescription, just like little Johnny here started off as -0.1, or excuse me, -1.
Okay.
But as they grew, their prescription increased. Now imagine with these treatment modalities that we have today, that -1 Johnny won't end up like -8 mom or dad. We can actually do -3, -4, which
so
is
bad.
actually pretty significant if you think
That
about the
is.
numbers.
Absolutely.
Right.
Yeah.
Sounds like early intervention is really the key, and at least early detection, at least, right? And doing those early screenings for your child. I want to go back really quickly just to have you, Dr. Hwang, tell us about the myopia management strategies used with pediatric patients. If you could just describe those in detail for us.
Right. So I kind of like to split them into a couple sections. So
Okay.
we do have children who are not ready for contact lenses.
Yeah, I was thinking about like imagining me placing those on my 5-year-old.
Right,
Oh my gosh.
right.
I can't even imagine.
Please. No.
There's no way.
We'll discuss it, but we talked about the hard lenses that kiddos sleep in or the soft lenses as well. But sometimes we can have, 5 or 6-year-olds that they do not want those suckers in their eyes.
No way. Yeah.
And their little dirty fingers, like all I can think about. They're not going to let me do it. I don't want them to do it because their hands are always
Right.
sticky and gross.
So there's a treatment called atropine. It is a drop that mom or dad puts in at bedtime in both eyes. Very low risk of side effects or any kind of, complications. But the focus is it helps relax the eyes. So while the kiddo wears the glasses or what have you during the day, the treatment itself helps slow down the progression. It's great for little ones that aren't ready for contact
Yeah.
lenses. I like to incorporate that into our practice, offer it as to parents, because a lot of parents, when you tell them about glasses or contacts, contacts, like, oh, they're not ready for it.
Yeah.
They're way too
No,
young, right?
no way. Yeah.
So that's like the first thing or one of the options. Another option is soft or hard lenses.
Oh.
There are daily disposable soft contact lenses that are what I call 2 birds, 1 stone. They correct your child's vision during the day, so they do not need to wear glasses while they're at school, while they're out and about, which is great for sports and hobbies.
Yeah.
At the same time, just like the atropine drops, they help relax the eyes. By relaxing the eyes, the keys actually help slow down the change or the progression of the myopia. Soft lenses are a great option. Your kiddo at any age can learn how to put them in and take them out. Age is not a factor. It's always motivation immaturity.
Yeah.
The other option is called orthokeratology, or also known as ortho-K. Those are the rigid gas permeable contact lenses that kiddos sleep in at nighttime.
Oh.
It reshapes the front part of the eye called the cornea. So during the day, they actually don't wear glasses or contact lenses.
Wow.
And at the same time, it prevents the eye from growing or stretching. Like we talked about, myopia is a long eye. So that's the growth that we're talking about. Not in the US yet, but there will be glasses that are multifocal, which also help kind of relax the eyes, prevent the prescription from increasing or the myopia from changing. There's a lot of options. Everything is case by case. We love talking to parents about the options your child has. So like I mentioned, it's no longer, hey, you see us once a year, one and done, we'll see you next year. Oh, next year your prescription has increased. We'll actually see these patients throughout the year to track their growth and progression. Technology's great.
Yeah, it is. It certainly sounds that way.
What are some of the classroom accommodations or learning strategies you were talking about at school if a child has myopia?
Right. So if you know your child is struggling, say, hey, they came in for an eye exam. Oh, they're going to get their first pair of glasses. Most offices, we don't hand them the glasses right when we see them.
Right.
Yeah.
The lenses have to be made, framed, things like that. So we always recommend, hey, until little Johnny here receives his glasses, please let the teacher know that he should sit at the front of the classroom.
That makes sense.
Children who already wear glasses, we always recommend like an anti-reflective coating on their glasses or a blue block coating on their lenses, which help protect the eyes against glare, against screens. Again, kids, they're on screens.
Yes,
all the
they
time.
are.
School.
Right.
It's a different time than when we grew up.
Screens.
Right.
I know.
They got their Chromebooks, their laptops, their iPads.
Yes.
So it's all about kind of helping them as much as possible to use their eyes with ease and not struggle.
Are you a big believer of blue light glasses?
I have it on
my
all of
goodness.
mine. Well, I have it on all
Yeah,
of mine.
just-
Yeah, ever since they first started offering it.
Oh my
yeah.
goodness, we should talk off the record. I'm just kidding.
Oh, okay. Oh,
I want to hear it. Tell us the tea. We want to hear it.
So I will say, myself and my husband, we have blue blocker glasses or prescription glasses with blue block lenses. In general, I always let patients know our eyes love ambient lighting. That's the lighting you have at home, that warm tone.
Okay.
All of our devices, your phone, your laptop, even like the car dashboard, you're like, oh, it's a really bright light.
Oh, I never thought about that.
And that's the light that you're staring at for 8-9 hours a day that
Sure.
can cause eye strain, eye fatigue. And so the blue light filter helps to kind of reduce those symptoms.
Okay.
Yeah.
We're like, okay. Taking notes. Add that to my Amazon
So
cart.
many.
Yeah, I
notes,
always say that
man.
it varies from person to person. Some people don't notice anything. Other folks will swear by it.
Wow.
But that's just my
No,
opinion.
good to know. Thank you.
And it doesn't, for people at home who have not ever had it on their lenses before, it doesn't change them into a blue color.
Yeah, good
like the blue
question.
block. At least I
Right.
haven't noticed that. Like I can't really tell. I can tell the difference when I'm not wearing them versus
Right.
when I am wearing them. But it doesn't make the lens itself look blue.
No.
Okay.
So I just wanted to make that
But
distinction.
you think it's important to have the blue light screens on your iPads, like the
Yeah.
Okay,
I always
I'm gonna
say-
get
anything to protect your eyes,
Yeah,
right?
I know. I'm gonna have to do that.
Well,
Right?
yeah.
That's amazing.
Dr. Hwang, what are the potential side effects or risks associated with these treatments that parents should be aware of?
Right. So we discuss all the pros and the cons. In general, though, side effects or complications are quite low. Even with the contact lenses, eye infection, scratch eye, things like that. Of course, it's not a 0%
Right.
chance, but it's actually really, really low. And it's the way that we designed our treatment. Daily disposable contact lenses are the healthiest option for soft lenses on the market. Your kiddo wears them once a day, tosses them at the end of the day. We don't have to worry about your kid cleaning the contact lens or storing them.
Yeah.
Easy peasy. The rigid gas permeable lenses are also very safe and effective. But we also look at things like dry eye. Dry eye can occur from contact lens wear. With the atropine eye drops, it is a relaxing eye drop. One of the potential side effects, depending on the type or concentration of the drop, is light sensitivity. And of course, everything under the sun can happen, but it's actually pretty low risk compared to any other like prescription medication that we ourselves or children may take.
Yeah.
It's very safe. Yeah.
I feel like soft contact lenses, daily disposable ones, have been such a game changer for me. I remember even just like 10 years ago when I had to wear the ones where I would clean them and store them. And I always
yes.
was
I
like,
remember those
I feel
days.
like I couldn't get my hands clean enough to clean them, you know,
Yeah.
beforehand. I cannot imagine having a child who would wear those and they weren't disposable, trying to get them to clean their hands enough to be able to clean the
I do remember getting mine very young. I think I was,
was 12.
Yeah, 12, 11 or 12.
Yeah.
So probably that age I would trust them because you're right. I cannot imagine my
It's
little
more mature.
5-year-old.
There's no way. There's no way. There's
But
no
are
way.
there 5-year-olds that use the contact lenses?
Yes.
Oh my gosh.
Well, they're clearly more mature.
Yeah, but who
than
are
our
those
kids.
parents?
Who are those parents? Get them in
I
the
wanna know.
pod.
Yeah, get
Y'all
let's
come
get
in here
them
and
on the
talk to. That's our expert. Our next expert.
Seriously. Oh my goodness.
How'd you do that, Mom?
Yeah. Tell us everything.
Tell us everything. We want to know the details. Tell us the details.
Are there specific tests or assessments that are particularly important for monitoring myopia progression?
Yes.
Ooh, what are they?
Myopia is characterized by a long or elongated eyeball. So we take a measurement called axial length. It's the length of your eye.
Okay.
So one of the things that we track is the length of your eye because it also corresponds with your prescription. The higher the prescription or the higher the myopia, typically the longer your axial length.
Okay.
So if we see a child whose axial length is growing out of proportion, usually that indicates to us, oh, we should kind of work with our therapy, see what's going on.
Okay.
We have another instrument called corneal topography. So basically, it sounds very fancy.
Sounds very fancy.
Photography.
So it basically measures the shape of the front part of your eye. It's great to diagnose, astigmatism, what types of astigmatism, but just a curvature which aids us in fitting contact lenses, soft or hard contact lenses. Great tool to have. We know with myopia, in the long run, it is also associated with a lot of eye conditions or eye diseases. So we utilize retinal imaging. There's wide field cameras you can use to check the health of the back of the eye called the retina. So we use all the tools in our toolbox.
What are some of those diseases or that you were just mentioning with myopia? What are they?
Right. Glaucoma.
Glaucoma.
Yes, that's a big
glaucoma.
one.
Can you explain that one? Because I've heard
what
it
is
a lot.
what is glaucoma?
Right. So glaucoma is a condition typically age related. So you'll
Okay.
think like your parents' age,
Okay.
but it occur at any age where due to high or increased eye pressure, there's damage to the back of the eye called the optic nerve. The optic nerve connects the eyes to the brain. So in general, glaucoma is painless loss of your peripheral or your side vision.
wow.
In the beginning stages, you have no idea. It's way out over here. But as the disease progresses, you lose more and more of your vision, and you're only left with like tunnel vision or ultimately like legal blindness.
How do they test for glaucoma?
Right. So
I say they, but I mean you, Dr. Hwang. How do you test for glaucoma?
Right. So when you come in for your routine eye exam or yearly eye exam, you might recall the eye pressure test.
Oh, it's that one. I hate that one where you have to keep it really open and focus on something and it goes.
Right.
Do you have to be dilated for that?
No.
Okay,
But
okay.
patients will recognize it.
I remember the poof.
I mean, I get it done every time, but every time I'm like bracing for impact, right?
Right.
It doesn't
Yes.
actually hurt, but it's just that,
It's that
ooh.
surprise.
Surprise.
Yeah.
Right. My office has a really, really fun one. It's this little
Oh.
handheld device that's almost like a quick little flutter.
Okay.
That's an easy one to check eye pressure.
Oh, nice.
Other doctors will use like a yellow dye and a blue light to check your eye
Yes.
pressure.
I've done that one.
Yes.
Okay.
But that's one of the main tests for
Okay.
glaucoma. We also use our microscope to evaluate your optic nerves. Photos done at your routine eye exam are pretty important.
Okay.
We're basically piecing together a picture, applying all the elements and family history, of course. So definitely something to check, even if you have perfect vision.
Well, that's what I was going to ask. If I have done LASIK, do I still need to do a routine? Oops. have not been going to the eye doctor. Nope.
You've been neglected because you can
I'm
see.
like,
You're like,
I
I
can
can see. Like it's fine. Like what?
It's
what
fine.
are they gonna
That's
tell me?
So funny. Okay, I need to make an
okay.
appointment.
You're not alone.
Okay.
It is, I believe, a common misconception. We
Yeah.
have patients with perfect vision or who had LASIK or PRK in the past. So they're like, you know what? I don't need to see the eye doctor anymore.
Exactly. I have not been since my
Bust
LASIK.
that myth, Dr.
I
Hwang.
know. Bust that myth.
Bust that myth. So you do need to go have regular
Yes.
eye screening.
Yeah.
So going to the optometrist at least annually.
Once a year.
Once a year.
So
Okay.
like glaucoma, what are the other things?
Macular degeneration.
Macular
macular degeneration.
Right.
Okay.
So that condition affects the back of the eye called the retina.
Okay.
Again, myopia or nearsightedness is an elongation of that retina or that eye. So having a thinner retina puts you at a higher risk, and macular degeneration is central vision loss.
Okay.
So what
So
you see in front
glaucoma
of you.
starts to make it like a
peripheral.
tunnel, and it's peripheral. Okay, and then macular degeneration is say it one more time?
Central. Yeah,
Central.
central.
Okay.
Right.
Okay. Okay.
Wow.
And another big eye condition that we always check for is if you've ever heard of like a retinal tear or
Yes.
Yes.
Yes. I
Same.
thought I had one.
Oh,
once.
oh my
no.
goodness.
But I didn't, thank
Okay,
God.
thank
But
goodness.
it was,
Goodness,
I
yeah.
got this eyeliner pencil in my eye. It hurt so
Ooh.
bad. And it felt like it was torn. And
Oh my goodness. Oh
Oh.
my goodness. That sounds awful.
so it wasn't.
Okay. Thank goodness. Thank goodness.
Yes. What about the cost of all this? Does insurance cover these appointments? And
Right, right. It all varies on your insurance, the type of tests, and things like that. There is a financial aspect of going to the eye doctor.
Right.
I always say, you know, even if you have perfect vision, if you're very, very young and healthy, one optional test a lot of optometrists offer is the retinal image. It's typically a copayment that a lot of patients will pay out of pocket. That one, it just shows so much about your eyes, and you can actually see the inside of your eye
Oh,
and
cool.
see what your eye doctor sees inside. But well worth it. I always say, again, eyes, something we use every single day. Couple dollars here and there, copay here and there, it's worth our while.
Right. And for glasses and contacts too.
Right,
How do
right.
people, because I don't think those are covered by insurance a lot of the time, right?
Sometimes.
It just depends.
Right,
Okay.
it depends on your insurance. Like we have patients that have excellent insurance.
And it covers everything.
everything.
Okay.
And we have like patients who have discount plans or insurances that only cover the exam. But we have wonderful opticians that help our patients with their needs, you know, their budget, just everything. So I always say you don't want to limit yourself to, hey, my insurance doesn't cover too much. Like there's a lot of ways we can work around things or kind of cater what you need, cut out the extras.
And you use CareCredit.
Yes.
Too. Yes.
CareCredit.
The CareCredit credit card.
Yes, that's a great way to kind of help our patients because we never want to make finances like that kind of wall that blocks you from experiencing, you know, the joy of seeing.
Yeah, and having the best quality of life you possibly
Right.
can. I mean, it's your eyes.
Yeah.
Hello.
Why wouldn't you?
Right?
Yeah.
Exactly.
That's so true. I have a kind of I hope this isn't a dumb question, but
There are no dumb
okay,
questions.
I'm
Go
sure other
ahead.
people have wondered this and
Yeah.
I have not Googled it. What is the difference? Like when people say, oh, 20/20, obviously that's perfect vision.
Right.
But what about like 21? You know, explain.
2100,
yeah, all that
2200.
stuff.
Wait, what? I've
Yeah.
never heard that. I've heard like 2015.
Yes.
Yeah,
But
I've
I've
heard
not-
that too.
2100? Please explain, Dr. Hwang. Please explain.
So, you know, even for me, it's hard to explain.
Okay.
So,
Okay.
in general, we call 2020 or 2015 vision like perfect vision.
Oh.
When that number that follows the first 20 is a larger number, say 2040, 2080, 2100, you can kind of correlate that as worse vision or blurred vision.
Okay.
So typically what it means is what, let's say someone with 2100 vision, or that's too big of a number, 2040 vision.
Okay.
What someone can see 40 feet away, someone with 20/40 vision has to stand at 20 feet to see the same exact image. So they have to be, you know, it's like,
I've
that's a
never
comparison.
known
That's
this.
a great
You're
explanation.
right.
Yeah, that's a
right.
really
So
good
Did know how to explain it, Dr.
did.
Hwang. It
That
was
was
not
a
hard
perfect
at all.
explanation.
Yeah.
So when I got 2015 vision after LASIK, that means it's better than perfect.
It's better than perfect.
She just wanted to hear you say that. Okay, Selah. Okay. Well, it is time for one of our favorite segments. It's Ask the Expert. Yes, you. Yes,
That's
Dr.
you.
Hwang. So these are
Yes.
questions from our listeners, okay? So let's go. You want to get started?
Oh, sure. Okay, this person asks, my husband and I both wear glasses. Does that mean our kids will have vision problems?
Good question.
Yeah. I think we know the answer.
Yes, yes. So definitely, if a child has one or both parents that wear glasses, contacts, or LASIK, there is a higher probability that they will also develop vision problems,
Yeah.
glasses or contacts, compared to a child who has one or no parents that wear glasses or
Right.
contact lenses. It's part of that genetic component in our genes. Just like blue eyes are passed from mom and dad to kiddo, height, things like that. It's all in the mix. It's all in the mix, right?
My kids are doomed.
Okay, even though don't do it, kids are too. Even though this sounds like it could be me, this is actually from a listener. Is there potential harm of wearing contacts for an extended period of time, over 20 years?
30 in your case, right?
Oh my gosh, tell everybody all my business. But yes, it is over 30. But thank you. Is there potential harm in wearing contacts for such a long period of time?
Right. So long-term contact lens wear, even with healthy habits, hey, I don't sleep in my lenses, I take them out every day, I replace them as directed. Over time, your eyes can become dry. And think of it as all the screen time that we have, the environment, the weather, the seasons. Women have hormones, so there are a lot of factors that go in. Contact lenses is just one of the other components. So it is very common that a lot of patients will have more dry eye as a consequence. But thanks to daily disposable contact lenses, I used to wear monthly contact lenses. I struggled with dry eye. Only 3 years ago, I switched to daily disposable contacts.
Oh,
So I had to, talk the talk, walk the walk.
Yeah.
I will not ever go back. It's made a huge difference. And the thing that was holding me back, and this is coming from an eye doctor, was the cost of the contacts. I just
cost
couldn't
is a
wrap my
factor.
head around, why would I pay 3 to 4 times more when I've used these monthly lenses for years and years and years, and I thought I was fine.
Right.
Right.
So I always say, you know what, it's worthwhile trying. I do have patients that come in, try them out, see how you like them. But overall, as long as you have healthy habits, you don't sleep in your contact lenses, you don't overuse them or overwear them, you see your eye doctor annually, you're typically doing well. I think dry eye is one of the most common complaints that come up later in life. But other than that, all of us will get dry eye.
Eventually,
Yeah,
just with
eventually.
age, just with
Yeah, and
living.
women, like you
Women
said.
especially, yes.
Hormones, all the things. So many things to look forward to.
Yeah, great.
This is such a good conversation and so informative, Dr.
so
Hwang. Thank
informative.
you so much for joining us.
Yes.
Will you come back again? We have more
Yes,
questions.
please.
We have more
Thank you.
questions. Thank you.
Thank you so
Thank
much.
you. Thank you.
Thank you so much for joining us and being part of our growing community.
Stay tuned for new Care Expert episodes every Wednesday. And don't forget to subscribe on your favorite podcast app and YouTube.